Anyone hear us? Welcome to Let's Talk ACA with JSA. We are waiting for Alex to join us with his audio so we can get started. Thank you for joining us for our second live monthly podcast series. I'm Kathi Wilson, and I think I see Alex. Hi, Alex.
Hey, everybody. Welcome to Let's Talk ACA. I'm Alex Ferron, joined by the lovely Kathi Wilson.
Hi, everyone.
Right. So let's keep on moving and rocking. So, like Kathi said, this is our second ever Let's Talk ACA podcast. You can see we're repping the JSA merch today. We got our awesome ACA shirts on. Maybe we'll even put these in the pro shop one day for any of you savvy ACA agents, huh, Kathi?
Yeah, and I made a nice little new sippy cup.
Oh, look at that.
We're getting there. We're legit.
That is pretty rad. All right, let me see here. Looks
Alex,
like,
do we have any changes that are going on?
oh yeah, we got some big
Yeah.
changes that we're talking about today.
So we're going to dive into a few things, guys. What we're talking about today is the 2026 market updates. We're going to go over one big, beautiful bill recap, short term returns. We can't wait to hear about that. You guys are going to be thrilled. We've got some news on CMS final rule, and then make sure that we're getting involved and getting certified for this upcoming 2026.
Absolutely. A lot to talk about today. So, what we're kind of going to do here, everybody, is we will take our time. We're going to go through what we got, talk about it in depth, have a little bit of a conversation, and then we'll have time for Q&A at the end. So, first, just a couple housekeeping rules real quick. So, what we're going to be talking about is everything you see on the screen today. If you have any questions throughout the presentation, please feel free to put those in the webinar chat box. We do see a couple people raising their hands. Again, we're not going to have like any sort of live audio from participants on this today. So please just put that in the chat. Kathi, it looks like we might be getting a little bit of an echo from you from what people are saying in the chat. So for that, I would say either if you can just quick turn the volume down on your computer, or if you have a pair of headphones quick, or just mute in between talking. That can just work as well. And then the presentation today will be recorded. So we're going to have a full recording, including the chat and the Q&A for everyone that would like that. And then we are also going to have a follow-up email going out to everybody tomorrow. So if there's anything that you missed, don't worry about taking super scrutinous notes. We will have a copy of that. If anybody's echoing, I do apologize about that. Feel free to just kind of follow along in the recording. It should be a little bit more clear audio. So thanks everyone for joining us today. Appreciate the participation. And then, yeah, let's have some great discussion today and just talk about what's kind of happening in the ACA market because it's been a crazy year. So let's jump into this right now.
So, Alex, I think one of our first topics might be prior to this change, certain states would allow agencies with agents to write on behalf of the principal or the agency. Is that still true, or are we looking at something different now? Or is it all states?
Yeah, not exactly anymore. So what we've seen in the last couple of weeks is some interesting changes from state departments of insurance, as well as United Healthcare as a carrier in general. Sorry about that, everyone. That's my cat. Peanut, say hi. She wants to talk about ACA today.
Hi, Peanut.
All right. So as we keep moving along here, the NPN override changes. This is an interesting change. So specifically for Wisconsin and Florida, the State Department of Insurance, they have said the following. And that's basically if you have an agency, if you're an agency owner, if you have employees underneath you working for your agency, they're saying that those employees or downline agents can no longer write business on your behalf. So as far as I know, this is a pretty common thing, especially with agencies that have teams of employees that work with maybe Health Sherpa or other sort of enrollment platforms. They have now expressly said in Wisconsin and Florida, hey, we're not going to allow that anymore. Really, what it boils down to is if you have a team of agents, they have to be licensed and certified. using their own NPNs to write that business to be the agent of record for the applications that they're submitting. So, Kathy, you might have had some experience with this in the past going up against call centers from your work
Sure.
in the field. This is something that I think isn't going to impact a ton of agents with their day to day business. And don't get me wrong, you can still have your employees take calls, help with clients' questions, sort of provide quotes and subsidy figures to them. Again, we'll talk about this a little bit, but make sure you're having them sign off on that PII consent form that CMS implemented a few years ago.
Right.
But in general, they just can't be doing the enrollments. Now, the question that comes to my mind, and maybe yours as well, Kathy, is how are they going to enforce this? You know what I mean? So, what would kind of be your first thought with something like that?
Well, unless they, just like Medicare and other lines of business, unless there's a complaint made out there, it would be hard to enforce something like this. They may randomly do an audit of some sort. So, this is the new changes. We just want to do the right thing.
My
And
thinking exactly. Yeah, I don't really see how this is going to be um, heavily enforced, so to say. I would say just kind of adhere to best practice if you have an agency with employees that help do that business for you. And explicitly, what United Healthcare has said as a carrier is pretty much lining up with what Wisconsin and Florida are saying. Hey, if you're going to write the business, you have to use your own NPN, you have to be licensed as an agent. So, just a heads up there, if you have any teams of employees that are working with you, just be wary that they should be submitting those applications only if they are licensed and credentialed themselves.
yeah, and from the client's point of view, I think that was, it's safer and maybe helps against fraud because, you have a lot of clients that are enrolled by employees or entities of the agency, and then they go to call on them because that's who's not who's listed. And it's a little bit of confusion that happens there. So, this just streamlines everything. So, just doing the right thing.
Exactly. And, I saw something in the chat here. Darla said the volume of enrollments might be a clue. And yeah, that could
Sure.
definitely be a
Sure.
case. If you have, and especially I think this is something that's going to heavily target call centers more than your sort of brick and mortar agencies that we primarily work with. If you have a single agent that is submitting hundreds of applications a day, sometimes at the exact same time as another application, which the marketplace can
Correct.
track sort of the time of submission, that's going to be a red flag. So, in general, even if you're working with employees, just work with them, be present in the enrollment process, and I don't think you're going to have an issue. That's the takeaway.
Yeah. So, what's going on with Illinois?
Illinois, that is an interesting one this year. So, like we've seen in the past couple of years, we've seen more of a transition for states like Virginia and Georgia, most recently
Right.
in the past, to convert to a state based exchange. And so, the question that I often get asked is why would a state do that? Why would a state convert to a state based exchange? And really, there's a few reasons why. In general, they're still going to get essentially like more federal funding as a state for running their own exchange as opposed to having the federal government run that for them through healthcare.gov. It sort of takes some of that onus off of the government, puts it on the state. So in return, they essentially get more funding for that state based exchange. And they can also include things like voter registration or Medicaid enrollment in their state based exchange, as well as have a little bit more agency over the plans that are offered.
Makes
So
sense.
with Illinois, they are going to something called Get Covered Illinois. And we'll talk about this a little bit later as well. We have a lot on the docket today, but their certification is currently open. We're going to talk about the time frame. So stick around if you're selling in Illinois. We'll give you a quick breakdown of how to get that done this year. But big takeaway, Illinois, not on healthcare.gov for the upcoming open enrollment.
So, Alex, if I was selling in Illinois, there's something I need to be aware of, right? That I can no longer use your FFM certification. You now have to get certified for the Illinois state based exchange and use a different platform.
Absolutely correct.
Yeah.
So the platform is transitioning from healthcare.gov to the website called Get Covered Illinois or Get Covered IL .com, I believe. Just Google it, you'll find it right away. The agent certification process is on there, and that's where you'll be doing your sales. And so the other big takeaway is I think you're already here with me, Kathy. What else can agents no longer use? A little third party enrollment platform that we're so familiar with, right? Health Sherpa.
That's right. So if you're on a state based exchange, you can no longer use Health Sherpa.
So what one of our suggestions is, and what we've seen, I guess some carriers suggest as well, in my experience, is if you have your client data for your Illinois clients that's still in Health Sherpa, you can export all of that. It won't necessarily remain there after these plans are either re-enrolled or renewed. So make sure to pull that data, just have it available so that you can reach out to those clients, make sure you're putting them into a plan and touching base with them this open enrollment.
Good tip, good tip. So we have OEP and we've got some good news to share.
I think so. I think so. So, with the changes this year, Um, I'm happy to say that I think OEP is going to be longer than we actually expected. Now, for those of you that are maybe return offenders and joining us again on the second podcast today, which I thank you so much for, last month we said that it's very likely the open enrollment is only going to be to December 15th, which is still a possibility. And we based that off of some information that was put out by Health Sherpa directly, as well as a few statements from carriers and CMS themselves. However, from what we're seeing now, it's very likely that this open enrollment, the 2026 one at least, will still be to January 15th. We have yet to see the exact final sort of statement on that, but the way that it's looking now is it's going to be a longer open enrollment again, which we're all really thankful for, I'm sure.
We are thankful for it, especially if you're running 2 lines of businesses that we've talked about before, Medicare and ACA. What a great Christmas gift this would be to extend it to January, right?
Agreed. A very nice
Yeah.
early Christmas gift for all of us. We all know that, a lot of our agents do double duty with both Medicare and other lines of business, ACA included. So having that extra month, even if it doesn't, get all of your clients that January 1st effective date, is really helpful for following up with those that still want to make a plan switch or are fine just rolling over into their plan for the next year. But you still want to have time to evaluate that with them, especially this year. And just one quick thing here, I did see a few more people raising their hands. Again, if you have any questions, please put those in the chat box for today. And then what we're going to do is have Q&A at the end. But I really thank you for your participation. So we're going to talk about Georgia Access in a little bit. That is what the Georgia State-Based Exchange is called. But let's move it right along. We have some important things that we want to recap from last week as well.
So, OBBA, one big beautiful bill recap.
Yes.
Talked
So
about enhanced subsidies. We went through a lot of different things, pre-enrollment verifications, which I want to make a correction from what I had recapped from last podcast. So I'll let you run through it, and then I want to define the actual pre-enrollment and re-enrollment.
awesome. So let's talk about ARPA and IRA just very quick. And I want to really hit on the highlights that you guys are going to want to know for this open enrollment. So this was the American Rescue Plan Act and the Inflation Reduction Act. It did a few things to expand the ACA, but I think most impactful of all, and what we're going to see the most impact from, is the enhanced subsidies. You may have seen this as EAPTC, the Enhanced Advanced Premium Tax Credit. This is what makes the Affordable Care Act affordable. So, with these acts expiring, unfortunately, those enhanced subsidies have not been renewed. So, essentially, it's not like something major in the past is changing that we've never seen before. It's really just a return to form for the marketplace. This was sort of a COVID era regulation that was used to enhance the ACA, which is now going away. It had the option, as far as I know, to be renewed during the One Big Beautiful Bill Act passing, which was not, unfortunately. So, what we're going to see here, and we have a little bit of an example on the next slide, is the enhanced subsidies are going away, namely, those making more than 400% of the federal poverty limit are going to be a hard cutoff again. Those clients will not receive any sort of help towards their ACA premium.
So, what kind of income do you think we're looking at that are going to lose that subsidy or would be affected the most?
Yeah, so we have a great example kind of on the next slide here. And again, for the follow up, all you guys are going to receive the slides that we talk about today. So if you want to go back and reference anything with the presentation and the recording, we're going to have that available for you. So I would say let's take an example of a client that I think is going to be commonly impacted. Let's say you have your couple, your husband and wife, your spouses in the late 50s to early 60s, right?
Right.
They're a two-person household. If they have kids, they're no longer dependent. They've moved out. They maybe have their own families at this point. So you have a two-person tax household. And also, you have a little bit of an older demographic that's aging into Medicare that's had time to build up their financial situation. So if you're making more than about 84 to 85,000 as a tax filing household, and that needs to be filed jointly, you're not going to get subsidy above 84, $85,000 a year. So it's going to be a hard cutoff again.
Sure. Do you think anyone below that, their subsidies will be affected?
It's going to depend. We're actually going to talk about this a little bit on this slide. Cost sharing reductions on silver plans. These are often a way that we sort of benchmark what the subsidy is going to be for the ACA in a given year. We can't estimate it perfectly right now. There's a little bit
Yeah.
of behind the scenes magic. We don't quite know how the sausage is made over at CMS with how they estimate that subsidy, but I would personally expect subsidies across the board to go down slightly for pretty much all brackets, but anyone over 400%, especially, hard cutoff.
Thanks, Alex.
Of course. So let's talk about some of the highlights here. And Kathy, why don't you kick it off with what you wanted to talk about with the verification?
So we were talking about, well, first of all verification documents will be verified. And what we have learned in recent weeks with agents enrolling, that documentation is very important. You're going to have to be prepared with your documentations. Once you submit them, they actually go to CMS, and you cannot enroll someone until it comes back to you. So prior to that, we were able to upload, not upload, get a notification that you need documentation, and that will no longer be what's going on. Also, automatic re-enrollments. I thought it had stated, without rereading it again, was that everybody needed to re-enroll, which is not the case. In 2027, that's what the bill is aiming towards, but currently the $5 only pertains to $0 subsidies. So I just wanted to correct that and let you know that we're okay with re-enrollments, but make sure you have your documentation for pre-enrollment verifications.
Yeah, well said. And if there are four in a family and one application, will everyone have to pay $5 each, or is this per application? So, as far as I know, because everyone's on the same application, because everyone is having that premium jointly pulled from the same bank account, it's just $5 per policy, not per member at this time, from the way that the regulation reads. So, essentially, that $5 premium is going to exist until the family goes through an income verification to say, hey, we have verified our income. Here is like our tax return, or here is a pay stub that shows our monthly income as a household. Once they prove that to the marketplace, they're gonna take off that $5 monthly premium. It's sort of a, I guess, a processing fee, for lack of a better word, for those that don't verify their income, but per policy, not per member the way it reads right now. I have one other here that I think we can answer quickly. Christy asks, what would the income cutoff be for a single person age 45? For a single household, that cutoff is going to be around $62,000 to $63,000. See what we're talking about here on the next slide. Okay, so a couple more highlights on the One Big Beautiful Bill Act. Stuff that you need to know this year. We're not going to go over everything, but for January 1st, 2026, they are changing the eligibility for DACA recipients. So essentially, this is what the government affectionately refers to as sort of the dreamers, mostly children that get some sort of residency status in the US. Previously, those people were eligible for the marketplace with subsidy. The only change now is that for 2026, they will not be subsidy eligible. So, still can enroll, but no longer able to receive subsidy. That is really the only change, as far as I know, for 2026. That is going to have to do with client eligibility in terms of residency status. So, that's one that we have to know. For the $5 enrollment, just to quickly clarify this again, this is anybody who allows their plan to automatically re-enroll without filling out a new application or resubmitting their application with income verification. Those clients with only a $0, a goose egg of premium, are going to get the $5 re-enrollment premium fee, for lack of a better word. Anybody this year, like Kathy said, who has a premium, they can still automatically re-enroll. Their plan will roll over if it's available. But for 2027, we're looking at that to change, where everyone is going to have to do manual re-enrollment. Complicated. What I'll say is that if anybody has a more in-depth question on cost share reductions and what the marketplace calls silver loading, just email me after the presentation. We're going to have all of our contact information available for you, and we can absolutely get a little bit more into that. So basically, what you need to know is cost share reductions are kind of like a dual special needs plan with a Medicare Advantage plan. Kathy, can you kind of speak to how those two coordinate or have coordinated in the past? Like, what does Medicaid do when a client has an MAPD plan, for example?
So when a client has a MAPD plan, Medicaid pays for the Part B. These plans are now being integrated and they are able to work with care of coordination. So they'll have one number, one
Exactly. And I know we're going to see some changes this year to how Medicaid is managed in a lot of areas. But in general, these would coordinate and they would help the plan not only pay the Part B premium, better care coordination, but they would also reduce the deductibles, the co-pays, the premium in some cases. So you
Sure,
can
you have
cut.
2 coming together, which equals this for a dual, usually.
Exactly. So for your, usually your fully qualified duals, they were not paying a premium on their plan. In many cases, it can be the same with a cost share reduction on a silver plan. But what this really does is when you run a quote, for example, through the marketplace or through a state-based exchange like the now Get Covered Illinois or maybe Covered California, it would show you if your client is eligible for a cost share reduction on a silver tiered plan. So what this would do would reduce the premium, reduce the max out of pocket, the copay, the deductible, really just make the plan more affordable for them all around. So what the change here is that normally in the past, how are those values actually getting reduced? Where's the money coming from? The carrier was eating those costs. Now, what they're saying is that the federal government is going to inject about $50 billion into the ACA to eat those cost share reductions for the carrier. Now, what this is in turn going to do, it's speculated, is actually increase the base level premium of silver plans. So, your full price silver plan, if you were getting that with no cost share reductions, no tax subsidy, it's going to make that plan more expensive. So basically, the way that the subsidy is calculated is based off of a full price silver plan in the marketplace. So if we see the cost of the silver plan go up, we're not really going to see those cost share reductions change. Those are still going to be provided, just the funding is different now. But the full price silver plan may change, which means that the subsidy calculation that the marketplace uses is likely going to change as well. So higher price silver plan, higher subsidy. That's probably what we're going to see this year.
So
Lesser
we were
subsidy.
using Medicare as a comparison of a dual, so Medicare and Medicaid working together with the government funding working with the ACA that will help with the cost share.
Correct. Yeah. The cost share is not really going to change very much, but the full price of the silver plan will, which will impact the subsidy. Hence, we're probably going to see a lesser subsidy across the board
Okay.
for all marketplace plans, bronze, silver, gold, platinum, what have you, just because that full price silver plan is changing just based on kind of where the money is going to come from. But your
Yeah.
silver clients, not really going to be impacted directly because they're still getting the cost share reduction. Don't have to worry about that aspect of it too much, but that's why we're gonna see a change in subsidy this year.
And you're going to see this in the benefit summary. So that's where it outlines what it's going to roll out to be.
Correct, yeah, and you'll see that when running a quote, a lot of agents have asked me in the past, "Well, how do I know if a client is eligible for cost share reductions? I don't wanna miss a really affordable silver plan for them just because I didn't know what I was looking for." Trust me, it's really hard to miss. If you're doing a quote on healthcare.gov and your client meets that income level to where they're eligible for CSRs, it's gonna tell you right at the front, and usually it pushes those silver plans to the top of the quoting list. All right, so
This one big, beautiful brain of Alex. Thanks, Alex. We'll have to dive into this more. So, if you guys are interested in topics, please email us at ACA@JSA Online. We're able to do individual online training, have conversations with you. But if there's something that you're not really getting, we're willing to deep dive into it with you.
thank you, by the way, Kathy. I like that one. And you know what I like? The acronym still works. It's still OBBBA. So
Yep.
go on. All right, let's move right along, folks. We're sitting at about 30 or so minutes here, and we got a little bit more to cover and then Q&A. So just quick, this is what we're seeing for the 2026 federal poverty limit chart. So in the past couple of years, because of the enhanced subsidies, you could consider this more of a guideline than a hard set cutoff. But going into next year, open enrollment, this is what we're going to see. So, who asked that question again before? I think it was Christy. The
Mhm.
top limits here that you're seeing on the right side, those 400% FPL amounts, these are annual adjusted gross income limits based on the household size on the left. These are going to be likely your hard cutoffs. For example, and Kathy, maybe you can speak to this more. Let's say, as a hypothetical, you are a financial planner and a tax advisor, as well as selling a little bit of insurance on the side, and you decide to work with JSA and pick up a couple of ACA products. What would
Sure.
you do in that situation if we're coming up to an open enrollment and you maybe have some higher earning clients that are going to be affected?
Being proactive. Everything that we're hearing and talking about is about being proactive. And as long as you have communication, I believe, with your relationships with your clients and letting them know ahead of time so that they're aware of what they're losing or gaining. So a lot of changes are happening, but let's not wait till the last minute. So identifying who those clients might be and having that conversation with them now. It's nothing you did, it's nothing we did, it's just what it is, but we have to make sure that everybody is knowledgeable and ready to take the next step or be prepared for it.
Exactly. So, I don't think it's very common that an agent, unless you are like a financial planner, would have all of their clients' income information. Maybe you're super, proactive, like we're saying, and you keep it all in a spreadsheet because you've helped them with subsidy in the past. These would be really good clients to target to potentially put them into a lower tier plan that's more affordable for them, more cost effective, or like we're going to talk about here now, we may have a return to form of an option for you. So, what's the news of the week, Kathy?
My goodness. So prior, currently, if I was going to write a short-term medical plan, I'm kind of limited, right? I have 3 months and then maybe find another carrier if they needed to go an additional 3 months. And that's it. That's where I am. Not all states offer it. Some states offer it.
Exactly. As of September of last year, we saw a federal regulation come through that kind of limited short-term medical plans back to what they were in, I always suppose you could say, like the pre-Trump era, like the Obama administration had a big initiative push towards the ACA, obviously. So we're seeing sort of a return of those policies. But now, just a week ago, we had a big update from HHS and CMS, and they essentially said, okay, the regulations are still in place. We know we have to work around that in some form, but we are not going to enforce them. So, really, this means, in my opinion, two things. One, the regulation is still there, it's still technically law. So, what that means is that we're going to have some state play into that. The second thing is that if they aren't enforcing it, that means that carriers are already jumping on this. I already saw it in the chat here. Darla mentioned it, and you hit the nail on the head, Darla. Allstate, as of today, has 12-month plans on their quoting platform. So these carriers are super quick. They are already ready to go.
Say
And
that again. They have
Allstate,
12 plans available.
Allstate already has 12-month term short-term medical
12
plans
month. Okay.
available today for tomorrow effective dates.
Nice. So
Yeah,
they're active. This is already being enforced. Guys, we can take short-term medicals now. We can have it for 12 months. And then what
exactly.
happens if you need to find another policy after that and the 12 months have ended?
So that's where we get a little bit of the state law playing into things. So let's take two states for an example here that we're both very familiar with. Your state, Florida, pretty open in terms of short term medical regulation. So if you live in Florida, you can take a 12-month plan with Allstate today, and the state sort of regulation states that you don't have any sort of rewrite limits. So short-term medical plans are underwritten products. As long as that client is healthy in the state of Florida, they can re-enroll in that plan back to back 12 months over and over and over as long as they pass underwriting.
Now, Alex, this is beautiful. I know we're gonna have so many agents that are just thrilled to hear this. We were kind of, handcuffed to what we were able to offer, and this might be more affordable than the ACA. So, guys, we are, fans of both, whatever we can help with, whatever suits the client best, ACA or short term, and it's worth quoting both.
Absolutely. So the thing that I really like about this is with the One Big Beautiful Bill Act, we didn't see any expansion of the ACA, which is unfortunate. Whatever side of the political spectrum you fall on, from right to left. I really like to see more options for people. I like to see competition between carriers putting forward the best product for that client, and not
Sure.
only the best product, but a myriad of available options for a client. So it's nice because even though the ACA hasn't expanded this year, now we're going to see that additional option of the short term medical plan come back into play to give those clients a more affordable priced plan, albeit a little bit more of a safety net coverage than something you would get through the ACA, but a safety net nonetheless, where before you're either stuck to paying something very expensive, going to a less
Yeah,
reputable product that hasn't been in the market for some time, or Frankensteining together some kind of ancillary package where if you get into the hospital, it's going to give you $5,000, but you have no out of pocket
yeah,
cap. Your heart attack's going to cost you 50,000 at the end of the
right.
day. We don't have to deal with that anymore. Very happy to see that we're having this regulation no longer enforced. The short-term medical carriers are coming back. And one thing that I saw mentioned in the chat again is United Healthcare. So UH1, we kind of put out questions to all of our carrier reps this week. We want to be on top of this for you guys. Also, check out, we're going to have some marketing blasts going out soon on this with any updates for you. UH1, as far as I know, hasn't changed their product yet. It is based on the carrier at this point. And so we had some sort of interesting conflict, for lack of a better word, between state and federal law. So I want to give one example here, which I think is really prudent, is the states of Illinois and Texas. So when the regulation went through last year in September, it on a federal level limited these products to 3 months with a 1 month extension at the most in all
Mhm.
states. So some states were like, all right, this isn't really that great of a product at this point. We're getting the expanded ACA. So Illinois, for example, they just said, okay, no more short-term medical. We're doing away with it on a state level. Texas, for example, changed their state regulations to be 3 plus 1 month of duration. So what it means is essentially the federal law is not being enforced by these government entities, but the state law is still in place. State law often supersedes federal law. And so the carriers have to sort of play around where these states are at currently to what they can actually offer on their platform. So Allstate is a great example. We see the 12-month plans available today. You're going to see them in Wisconsin and Florida. Rewrite rules are based on what's available in the state. But because Texas has put those laws in on a state level, we are waiting for those regulations to actually change. And so, sort of the band aid here is that CMS and HHS aren't going to enforce, which is why we're seeing these carrier platforms have these products return until the regulations change on a federal level, which we think the states will follow suit. So it's sort of, I guess, what would you call it? Like a little bit of a stim injection to get these plans up and running again until we actually see the law change. It's just not being enforced currently, but they still have to adhere to federal law. So that's why Texas, you're really only going to see like 3 months available at a time right now, which is kind of
So,
the
is this available in every state?
nope. So that's where the
Right.
state law comes into play. We're
And we
seeing
can
it most
produce a
influence.
list. I know a lot of you are asking if your state offers short-term medical. UH1 is one of the short-term medicals that's offered through United Healthcare that we were referring to. So, no, all states don't offer short-term medical. Like Alex had mentioned, Illinois took the stance that we're not allowing it anymore. And that might change.
Correct. I think what we're going to see is once the federal regulation changes, which now at this point, I'm frankly surprised. I mean, I think this was more of an initiative by CMS than potentially something coming down from the top of the hierarchy here in government. But I think now that they are no longer enforcing that rule is what's going to jumpstart the regulation to change, which I didn't expect to see this year, frankly. And oh, I'm
Yeah,
very
it wasn't even
excited.
on our radar, right, until the past
No,
couple of months, there was some rumbling about it, and then here we are, so great news for everybody. We can produce a list of states that offer short-term medical along with the carriers that we offer through JSA for our listeners. This is being recorded, by the way.
absolutely. So, one of the things that I want to kind of address here, which I'm seeing a little bit of discussion in the chat, and really this is why we're talking today. We want to discuss this with you, in part what we have learned from our position as an FMO agency, working with carriers, working with these entities. And as far as I know, the regulation is still there in the case of what the carriers are allowed to offer, not an agent. So, really, from an agent perspective, if you sell today an Allstate 12-month plan and that is being allowed by the carrier, that's not something that at that point is your responsibility as an agent. Nothing would ever come back to you as far as we understand based on what we're seeing from the statement. And I'm going to
That's
include
right.
the exact
That's not the
statement from
agent
CMS.
breaking the law, right? That's, it's just a product that's offered that happens before the agent gets involved.
Correct. So it's the ability for the carriers to offer these products at the term limits that they're able to offer them at. So that's what's no longer being enforced by CMS as, again, sort of a band aid until the actual regulation changes. Again, this is only a week old. We're already seeing Allstate as one of the first carriers to jump back into this market. They seem very confident in what they're able to offer at this time. So we'll see what's available. We're going to keep everybody apprised of this. And again, if as an agent, you don't want to offer this type of plan to your client for whatever reason, that's absolutely your prerogative. And I think it's great that agents want to advise their clients of what plans are available. Again, that's where we're kind of seeing it now. I do expect some of our other carriers like Pivot Health, especially very soon to follow suit. United Health One, we're very likely to see them do the same. So we'll just see kind of how that pans out. But that was really, I think, one of the big kind of stories this week that we wanted to.
Good stuff. We're here just to report.
Exactly. And let's move right along. We got a little bit more to talk about today, and then we'll have some Q&A at the end. So the other thing that is going to be coming up here very soon is the CMS final rule. So let's talk about
There's
this a
2
little bit.
names for that, right? Because if we see PPACA and we see CMS final rule, are we talking about the same thing?
Yes. Like most things in government, we like to give it a really catchy name that just rolls off the tongue, like the Patient Protection and Affordable Care Act, which is also considered the Marketplace Integrity and Affordability Final Rule. Really a good one, you guys. But basically, what this is it's just the marketplace saying, hey, here are the rules that we're going to adhere to for the upcoming open enrollment. This is how it's going to work for the ACA in the marketplace this year. Here's a few things that we're implementing. And really, this is just the marketplace coming forward, solidifying some rules from their end as well as to, what's sort of in the one big beautiful bill and really enforces a lot of these things. So let's kind of go over these one by one, what I think some of the highlights are. So first off, this is one that is going to take place next year, but I think it's one of the most important rules is the standardized OEP in 2027. So, like we talked about earlier, what are we kind of hoping to see for a time frame with open enrollment this year?
January 15th.
That's what we're hoping. Still fingers crossed. It could potentially change, but that's what we're looking at for this year. It's being more and more likely that it's going to be to January 15th. However, 2027, what the rule explicitly states is a standardized OEP for the federal marketplace. And what that means is no longer than December 31st, which is kind of interesting. So previously, the cutoff was December 15th. We saw that extended out to January 15th. Now, all of that this is saying is that it can't be longer than December 31st. So if I had an estimate, what is probably going to happen for healthcare.gov is next year, we're going to see November 1st to December 15th. Then, as we get towards that December 15th date, we're likely going to see the marketplace extended out an additional 2 weeks. But we're still going to see the cutoff date of December 15th as what's most likely put on paper. Exactly. So, Let's talk about a few more things here. Let's go to the strict 90-day income verification. Now, this isn't a huge change because really all that this is saying is in the past, if the marketplace needed to verify income for a client and they asked for that verification, they had 90 days. And then the marketplace would actually extend that by an additional 60-day grace period. So essentially giving that client 5 full months to provide that while keeping their plan effective. What it's saying now is we're just taking away that 60 days. So you still have the 90-day income verification window. If the marketplace requested information from you, your clients just aren't going to get an additional grace period. They just have 3 months to provide that. If they don't provide that, what that's going to do is essentially that client loses their subsidy. So, very important. Proactivity is the theme today. We have to make sure that those clients are proactive in providing that to the marketplace.
What are some
So,
things that can be used for the income verification?
great question. I saw a couple people ask that in the chat. So, what we've kind of been seeing is tax returns. If it's after the first of the year and somebody is, again, proactive, they get their taxes filed and they get the return, your annual income can be provided on pay stubs, basically any other sort of financial verification. Like if you were able to get that from a bank with your direct deposit, something like that, that just verifies the household income based on what you file for your taxes. That's what the marketplace is going to look for. They're going to provide additional guidelines on that. And when we do say marketplace, I'm primarily talking about the federal marketplace. The CMS final rule applies to the federal marketplace. State-based marketplaces can still kind of have their own rules with what they want to do. So the other thing that we found is, I would say, one of the larger things in the CMS final rule is going to be past due premium denying coverage. So previously, if somebody had a past due premium that was owed to a carrier, they would still be allowed to enroll into a marketplace plan going forward. Now, what the final rule states is that if you have past due premiums, a carrier then has the ability to say, okay, we're not going to enroll you into our plan until you settle up that past due premium. That is going to be a lot more strict. So it will allow denied coverage essentially if your client has outstanding premium. Not a terribly uncommon thing. I mean, we see that in Medicare all the time, where if you haven't paid your premium, your plan will lapse. You might not be able to enroll with that same carrier again. We're just seeing that put more strictly onto the marketplace.
Yeah, so what's the risk here is that you could go without coverage. Just got to be aware of who has premiums. A lot of you work with clients who have subsidies. A lot of you work with middle income families. And if there is a premium due, especially if it's re-enrollment or if you have a client, and you're not using an AI system, which does automatic reminders for those clients, then you may have to get involved if it benefits you.
Exactly. Exactly. So when is this all going to go effective? It's going to go effective August the 25th, 11 days from now. That is when officially this rule goes into effect. And a lot of it, again, not going to be impactful until we actually get to open enrollment. But that is technically the effective date of what the CMS final rule is for this year. Again, if anybody has questions, I can send the full breakdown. We're not touching everything that's in the rule today, but those were the ones that we thought were really the highlights that you got to know. So
When you say effective date, sorry, for the CMS final ruling, that's the effective date of the actual ruling, but it may pertain to a later date of whatever the ruling might be for open enrollment or what have you. So does it mean that everything takes effect 8/25 and these are now the rules that are in place?
exactly. And I mean, the best example of that is the standardized OEP. We're not even going to see that come into effect until 2027.
And for clarification, guys, there are about 20, maybe more now with Illinois and Georgia joining. State-based exchange. Every other state is on the federal facilitated marketplace. So mainly what we're talking about is federal. And we can deep dive into state-based on a one-on-one basis with you.
Exactly. The state-based exchanges always have a little bit of their own rules, so let's talk about that a little bit more here. But generally, we're talking about the federal with a lot of these updates. Some of the states will adopt them, but it would be very difficult to go over 20 something individual rule sets for every single state-based exchange. So if you're working in a particular state, Virginia, Georgia, Colorado, Washington, California, let us know. we can kind of help you out with anything that you need to know about the state for this year. So, what do the agents need to do, Kathy, to get ready for open enrollment besides being proactive?
Yeah, so certifications are coming up. I know we have a lot of other things going on in the Medicare world, but for ACA, we have a hold for our 2026 certifications for the federal facilitated marketplace on the CMS website. That date has not been announced, but as you have listed here, it did close on 7/11. So if you have not done your FFM certifications ever and you're brand new, once you do your 2026, it'll cover you for 2025. So no worries there. However, we do need to be on the lookout for it. If you would like me to add you to our waiting list, as soon as I know the date, guys, I'm going to let you know because we're all waiting for it. Everybody who's licensed and sells ACA has to do the 2026 certifications. Two tips I have to make sure once you've done your certifications, you can also go on to CMS and do help on demand. It's a course you can take, which will then allow you to set up a profile. It'll ask you to go live, and then you can receive live leads from the portal. So I believe it'll actually text you if you want to accept or deny the lead that's coming in. So you'll be listed as a local representative. Also on Health Sherpa, this is for the federals, guys, not the state. If you enroll into the Enrollee Assistance Program, that's where you see bonuses. So Health Sherpa runs its own platform. It's not tied to an agency. It's not tied to us. So when you see bonuses, that's something that they give to brokers or agents who enroll with them, which means that if you're not contracted with a carrier and you enroll in that bonus program, and you upload, you'll be paid by their platform, bill.com, a one-time bonus for enrolling someone into a non-contracted carrier.
Awesome. Yeah, I think those are two great tips. If you really want to get involved in the marketplace, those are the kinds of things that you need to be doing. Help on demand is one that I recommend to pretty much every agent working on the federal marketplace. And there are some platforms for state-based marketplaces that have that same sort of thing as well, where you sign up as an agent, you put your information to be available to take hot leads from clients that call in, whether it's a state-based exchange or the federal marketplace. They want to work with an agent. They don't want to work with somebody on a government call center. They want that personalized touch, somebody who's really going to help them out and be able to provide them all kinds of information about all the carriers. So help on demand is a great way to scoop up a couple extra leads. So the number one question that I get at this time of the year is, when is the federal marketplace certification going to open again? And we never really know until it opens, which, is a little bit of a pain for us and for agents. I hate not being able to give a nice time frame to you guys that are asking, because I know you want to get in there and be proactive and get it done well ahead of open enrollment. So close down 7-Eleven. Usually what we see is that takes about 6 weeks to reopen. We're right at about 4 weeks right now. I would expect that to open up again in another week or two. And like Kathy so eloquently said, if you do it for 2026, you're good for the rest of 2025 as well. The others that we are looking at here are Georgia Access, Maryland, and Get Covered Illinois. If you're working in any of those states, those are currently open for you to certify for plan year 2026. Quick tip to you Illinois producing agents: 10/17. What is that date? October 17th. That is the cutoff for certifications. Federal marketplace, you can do it anytime. It's always going to be open once it opens until it closes next year. 10/17/2025. Get your Illinois certification done by then. If you even have any inclination of selling in the state, if it's after that point, you're not going to be able to certify from what they're telling us so far. Georgia, Maryland, Illinois. If you want to hop on it, you're selling in any of those states, you can do that right now. Any other little tips about certifications, Kathy, from somebody who has experience in that before we move on to our Q&A and wrapping up for the day?
Yeah, when we do the federal certifications, we're going to have guides attached so that you guys can follow along. If you've been on CMS, it's a bit confusing trying to find that MLMS training guide and adding the application. So we'll be able to help you through that. And then you will need to get contracted right away if you're new, and we'd love to help you with that. Again, guys, just being proactive, knowing that what's going to happen with the changes. The main takeaway points that I would take as an agent is that I need to make sure that there's documentation for SEPs, for income, for loss of coverage, for anything that you might need to upload. Before it was kind of a random audit, whether you had to upload or not. Now you're not going to be able to enroll and start the policy. So make sure you have that and you're timely on it. It sounds like it would be better to try to get that information in the beginning of the month and front load that because it can take 3 weeks or more according to CMS to proof that, verify it, send it back to you so that you can enroll that person. I had an agent reporting it was 6 days. So, open enrollment and times that where there's a high demand and things like that, we don't know, right?
Exactly. So again, be proactive. I would expect a lot of certification platforms to come online in the next 2 to 3 weeks. So just keep an eye out for those. If you have any questions, again, keyword is get in touch with JSA. We're going to help you out. And I see 2 questions here quick before we move on to the general Q&A that I want to answer because they're relevant to this.
Yep.
Carmen asks, can a new broker certify in Illinois and Georgia without the FFM certification? Yes, you don't need the FFM as well to sell in a state-based exchange. If you're selling only in Illinois, just do the Illinois. Only in Georgia, just do the Georgia. And again, these carriers don't have any carrier specific training, oftentimes like they do with Medicare Advantage plans. It's really just making sure you're able to sell in the states that you want to sell in, whether they are on the federal docket or a state-based one. Second question I see here is Margot. Margot asks, I missed what you said. Did you say Health Sherpa does or does not support Georgia access for 2026? As far as I know, there's only one state-based exchange that actually uses Health Sherpa. I'm pretty sure that's Arkansas. Take that with a grain of salt. I got to double check on that one. Georgia did last year, I'm pretty sure, use Health Sherpa because they were kind of in like a transitionary phase between state-based and federal. This year, I don't think they're going to allow that. Let me check on that one for you, Margot. I'd be more than happy to look into that, and I'll put something in the follow-up email as to whether or not there's other state-based exchanges that will use Health Sherpa. But at this time, I don't think they're going to allow that. But let's move on to our general Q&A here. And
Yeah,
Kathy, how about you and I pour through the chat? We had a ton
sure.
of engagement today, and as always, thank you guys. This is why we're here. We want to have a discussion and not just talk at you as much as possible, even though I know it's a one-sided webinar, but we want to have the presence here. So first off,
Again, if there's some questions that are burning, we'll answer them with our ACA at jsaonline.com. We'll then contact you so you can have our phone numbers. Call us anytime. One thing at JSA is that I can say 100%. And if it's different, please let me know. We answer our phones. We have 4 different locations, headquarters filled with agent relations that are able to help as well. And we answer your questions. So let's go through this chat and see if there's anything that we can try to get to. You answered the one about the age. So clarification on the $5. More time, but we can keep talking about this because I know it's confusing. $0 subsidies will get a $5 charge if you don't enroll them, and they're going to be automatically enrolled. And the risk is that they're not used to paying for anything and there's no bank account uploaded. And so that $5 might have to sit and they won't be active. So we want to make sure that you're re enrolling people and not letting them automatically enroll. Why not?
exactly. So these are primarily your clients that are re-enrolling automatically, like Kathy said. So that's really the ones that should be kind of touch base with this year. And then again, that $5 premium isn't going to persist for the entire year. It's based on the verification of the household income. So that's really the ticket here is verifying the income for that family or individual to prove that they are at the income level that allows them a $0 premium plan. So that's why they're tacking that on until they get that verification. Let's keep moving along.
And you don't have to re-enroll them if they're gonna be on the same plan if there's no verification needed. That was one of the questions, if you have to re-enroll them on the same plan. That's up to you. If there's documentation that is needed that wasn't needed before, then yes, you're going to have to do that.
Exactly.
or at least upload it. So call it what you want, re-enrollment. It's not a new application necessarily, but that's going to be addressed.
I'm going to jump one question here and
Yep.
answer Ruth Ann's question on the re-enrollment effective 2027. So each client has to enroll in their same plan again. Essentially, yes. Come 2027 open enrollment, they're going to do essentially the same thing they're doing this year with the $0 plans for all clients. So it's not so much as that you have to manually re-enroll those clients. It's that they want the income verification to prove how much their subsidy is year over year. And then if they had anything like a change in residence, a change in family, like an addition or subtraction of a family household, whether having a child, divorce is common in that case, that's what they want to prove. So it's not so much as the manual re-enrollment of the policy, which will be required. They're looking for the verification. So that's what it comes down to for the next open enrollment. But I just wanted to jump the gun on that one because it's relevant. Christy had a good question though. What are the pre-enrollment documents needed? So I guess in a lot of cases, Kathi, you were talking about the SEP verification last week or last month, rather. You had a couple agents that were dealing with SEP sales and what they had to provide to the marketplace. Can you speak a little bit to that?
Yeah. So loss of coverage, they're going to have to show for that. Income,
Yeah.
they're going to have to show for that. Change of address, I need to clarify. I'm not sure if you remember if that needed to proof for moving, but any life changes, any documentation questions like that, that's going to be a pre-enrollment documentation. And that may already start. Like I said, I have a agent that's doing that, and it took her 6 days to get it back from CMS, so it's already happening.
Yep. So for SEP sales, they're going to want a verification of the SEP. So whether that is um, a loss of coverage from your job or otherwise a change in residence, they want documentation to essentially prove that you are eligible for that SEP. So moving right along, it looks like Jody and Michael also asked about the $5 monthly premium. Michael, if you would like sort of the official literature on that, for lack of a better word, we can send that to you. Just let me know. Again, my follow-up email is going to be going out tomorrow. The presentation is fully recorded, including the Q&A. We're going to hang out until we have pretty much everything answered for you guys, so feel free to do the same if you have the time today, which we greatly appreciate. All of the basically follow-up materials, the slides, the recorded presentation, that's all going to get to you guys tomorrow. Let's see here. Ruth Ann asked again, please restate the effective date of when pre-enrollment docs will be uploaded and then one can enroll once CMS has approved. When does that start? So it's already started for SEP sales. For the marketplace, if they require any sort of verification of income, that will be done during the enrollment process. It will ask the client to upload documents, or the marketplace will reach out to them directly via email, via call. Every client that signs up on the federal marketplace, and most state-based ones are going to have a client account for something like that. They will be notified of what they need to provide. So it will be done essentially post-enrollment process. You will submit the application, but the client won't be effectuated until the marketplace has the documentation with what they need. Michael also asked, $5 even on state exchanges like Cover California? No, as far as I know, that only applies to the federal marketplace. State exchanges will have their own rulings as to whether or not they are going to enforce something like that. Aaron, you must verify income before you can apply. Nope, you do the application. They will reach out to you for income verification afterwards. Like we stated earlier, it's going to be a hard 90-day window for any sort of verification. Marie, is JCAA ACA available in Oregon? I think we maybe only have like one product available in
Carrier,
Oregon.
maybe?
Oregon is a state which, from what I'm seeing, has a lot of kind of like local players in their ACA market. They have a lot of kind of health systems that run their own plans. And with the capacity we do our business in right now, we're slowly bringing on some of those more regional players. If there's one that you guys think you could do a lot of business with, let us know. We're constantly pursuing new appointments to offer. So just a heads up there. And the big one is Kaiser. on the West Coast. Unfortunately,
Mhm.
they don't work with FMOs right now unless you're only selling Kaiser. We remain independent. We're always going to be independent. So until those companies like Kaiser and Florida Blue open up to the FMO channel, we're not going to be able to offer those products. Okay, let's keep going here. Rebecca asks, are the state-based programs required to follow the same subsidies and general eligibility rules as the federal program? No, they are not. They are likely to adopt some of them in some states. Again, we need to see the sort of final rules from sort of those state-based exchanges, which come out later in the year. The federal marketplace is always the more, kind of proactive one. So let me see here. We saw a few questions about why we're talking about Medicare. That was really just a comparison to sort of understand how CSRs work and the way that they're implemented with the plans, how they reduce deductibles and copays. And the best sort of example we like to give is how Medicaid works with an MAPD plan for a dual special needs client. So, really, just an example. Let's see here. Bo asked, I received a notice yesterday from the Colorado Exchange stating that DACA individuals will lose eligibility for health insurance coverage through all marketplaces effective August 25. So, yes, that was part of the One Big Beautiful Bill Act. So that applies to DACA recipients on a federal level. So that is why, for that one in particular, because it's a federal designation of the actual, I guess, lawfully present status of those people, it changes how the marketplace rules affect them. I suppose the government is saying that even if you're a state-based exchange, you can't accept those people with subsidy because now on a federal level, they aren't even designated as such. Let's keep going
You
through
guys
here.
got to jump. Thank you so much for joining. We're going to keep going. This is going to be recorded. So if you registered for this, a recording of this podcast will be sent to you, and we will be live next month, same time, same day.
Yep, exactly. We're going to do another one of these in a month, y'all. We're going to stay up to date with you guys all the way up until open enrollment. Let's keep going here. Ton of questions in the chat. Thank you guys so much. I
Mm.
really appreciate all the participation today. Roger asks, is the income in the FPL chart based on adjusted gross income or taxable income? It is AGI. That is what the marketplace cares about, adjusted gross income. Janine, does California have short-term medical? They do not. Michael asked about the actual statement from HHS and CMS on the short-term policy availability. Michael, I'm going to send out the official statement from CMS to everybody in my follow-up email tomorrow. So I will have it in black and white, exactly what they are stating as to how they're going to enforce, or rather the non-enforcement of the federal regulation on short-term medical plans. Darla, United isn't available since yesterday when I called. That's talking about the updated short-term medical plans. We heard back from our rep this morning, essentially TBD. More on that to come as to when they're going to offer those. Let's see here. Ruth, you ask a very good question. Does exhausting a short term plan qualify for an SEP onto the state exchange? Kathy, you want to hit on that one?
I don't know the answer to that. I don't believe it does. Well, loss of coverage. So let's think about this.
You had it right the first.
Medical plan, you'd have to prove loss of coverage. And if you've exhausted it in the state that you're in,
Yep, looks like Darla hit that one too. Unfortunately, they don't qualify for S.
stumped.
Yep, so the reason why that is
It's not
because
credible coverage or it's not.
exactly. They are not considered ACA creditable coverage.
Mhm.
So, because of that, the ACA doesn't recognize them as a loss of coverage. It needs to be some sort of creditable coverage. In most cases, like a group plan, is what's going to
Right.
cause a loss of coverage. Do you know short term is available in Minnesota? That's a good question. I don't off the top of my head. If it is available there, we have very limited carriers there. I can double check on that one for you. Okay, let's see here. Elizabeth, what's the risk to the client to do short-term medical versus the ACA? Is there all ACA protections and are they fully major medical? So no, they are not. That's part of the reason why you don't get an SEP when your short-term plan runs its duration. So as sort of a follow-up to that, very important that if you have a short-term client, you have an option for them when that short-term plan gets exhausted, whether they are healthy enough to apply for another one, or if it falls into the open enrollment time frame where you can put them onto an ACA. The biggest difference between a short-term medical and an ACA plan is a very crucial one, and that's that short-term medical plans are medically underwritten and they do not cover pre-existing conditions. The ACA doesn't have any sort of medical underwriting, and it does cover pre-existing conditions. As a benchmark, ACA plans are strictly better coverage than short-term medical. There's no conversation to be had there. They simply are. When it comes to short-term medical, they are often a fraction of the price of a fully priced ACA plan and give the client a stop loss sort of coverage to if they had a medical emergency. They have a safety net because there's a maximum out of pocket on those plans. However, they don't cover pre-existing conditions. If you had a heart attack 2 years ago, but now you're healthy enough to pass underwriting, you're not going to have a heart attack covered again if that comes up in your claims history. That's the
Right.
biggest difference is the pre-existing condition coverage. Are they available in Texas and Oregon? Oregon, I need to check. I don't think so. For Texas, they are still adherent to their state law. So that is 4 months of coverage right now until that changes, but they are available in Texas. Aaron,
Oh, that's a tricky question we just got. Is it true that ACA is not credible coverage for Medicare? Let's dive into this a little bit.
that's an interesting one. And this comes down to a lot of different factors. So
First thing I think of, why do they have ACA? Why do you care if it's credible coverage if you're T65 or if you're trying to stay on it because you have Medicare? So it is against the law to have ACA if you're eligible for Medicare.
in 99% of situations, correct. There's one important caveat there, and that's for those clients that are not getting premium free Part A Medicare, which
Correct.
is the vast majority of people on Medicare. They have their premium free Part A because they've worked their 40 quarters or they
Correct.
are able to kind of piggyback off of a spouse's social security.
Right.
So the situations where I see this arising are I actually had one the other week. Hey, my husband is turning 65. We're in the middle of the year. He's already paid into the deductible of his ACA plan and he is going to retire and he wants to keep his ACA plan. Okay, I understand. You've paid your deductible. You like your coverage. Maybe you have a doctor that's in network that you go to. So you want to sort of maintain that care. That's very normal. You had a plan that works for you. You want to keep it, right? However, when somebody turns 65, the real creditability question here comes into play of who is the primary payer of claims? That's the question. So when you turn 65 and you're eligible to enroll in Medicare, you've worked your whole life, you're a US citizen, so you get your premium free Part A and you have to enroll in Part B, right?
Right.
Maybe you're still working, but you're going to retire because now you're Medicare eligible. But again, you like your ACA plan. You've paid into that plan. You
Sure.
want to use the coverage because now your deductible is gone. You've paid it all and you're in the coinsurance phase and it's working for you. And maybe you had a health issue, unfortunately. When you turn 65 and you enroll in Medicare, or rather you're eligible for Medicare, Medicare becomes the primary payer of claims. ACA becomes the secondary. You can keep that ACA plan, but you have to pay full price if you're getting a subsidy because the government is saying, well, why would we subsidize you? You're eligible for Medicare. You're 65. You're already getting help. We're offering you help. Medicare becomes a primary payer. If you have original Medicare, your ACA plan can almost be used as a supplementary insurance. But if it's full price and you're 65, who wants to pay $900 a month for supplementary insurance? That is not fiscally viable for the vast majority of people, and there is no guarantee that your ACA plan is going to pick up claims that were already covered by something like an MAPD plan.
So if they're
So
on an ACA plan and they're worried about being penalized for not getting their Part B,
they should be.
they're going to get penalized if they don't get their Part B because ACA will not be credible coverage because you're eligible for Medicare.
Correct. There's two main types of creditability that we have to talk about here. First, creditability, Part B Medicare. If you're 65 and you're eligible to enroll in Part B Medicare, ACA plan is not a creditable way to delay that.
That's
A
right.
group plan with more than 20 employees is creditable coverage. That's why we see people that want to continue to work use their group plans. They're able to
Correct.
delay Part B. ACA, not the same way.
When we're talking about Part A, you have to work 40 quarters, which is the 10 years to be able that's when you've paid your taxes in, and that's why Part A is free. If you have not, Part A is going to cost you. If it costs you then you're not eligible for Medicare. I'm not sure, would that mean that it's unaffordable and you would go to an SEP?
It essentially gives the client a choice at that point. Most
So that's the
common
only caveat where you could have ACA and not Medicare. It's if
correct,
you're a Part A, meaning that you haven't worked enough quarters to get that for $0.
exactly, and the most common sort of scenario we see that with is a lot of times foreign nationals that have come to the ACA
Correct.
or ACA, the USA at a later stage in their life. Now they're over age 65, but they haven't worked those 40 quarters to be eligible for their free Part A Medicare. Those clients can stay on the ACA. But to kind of wrap up the point here, the second creditability that's important with Medicare is what? It's not Part B, it's Part D as in dog. The ACA is actually creditable drug coverage. So you might still rack up a Part B penalty, but if you stay on your ACA plan, you're not going to rack up a Part D penalty. But that's not as important. A lot of clients are going to be obviously more concerned about the direct healthcare side of things. So just a heads up, if you have a client who's
Yeah.
65, they're eligible for Medicare, in the vast majority of situations, it's better for them to enroll in Medicare and get on a MedSup or an MAPD plan. That's a very intricate question, though.
Yeah, and if they can't afford their Part A and they wanna stay on ACA, as a broker, I would say the better play on that is to help them apply for Medicaid, and if you don't know how, I can show you how, and then put them on a dual plan, because then they'll have their Part A and B and any penalties paid with a very great integrated plan.
Exactly. So
0 cost, right? So, for anything. So that's the better play.
exactly, exactly. Kathy is a DSMP expert. Don't ask me about that. We have somebody here who knows far and above what I do. If any of you guys have dual special needs plan questions, let us know. Okay, let's hammer out some more question and answer here. Aaron asked, do you guys contract agents for short-term medical plans? And if so, who is available in Western PA? Yes, we work primarily with three carriers on a national basis, Allstate, Pivot Health, and United Health One or UH1. Some of you guys might know by their old brand name, Golden Rule. We work
Mm,
with all three of those in all states where they're available. PA is another one of those where you get into the East Coast and a lot of those states don't allow short term medical, like New York. So every carrier is also a little bit different in where they offer plans. So we don't have a full listing of every state that has a short term medical in it based on carrier, but we do have the individual carrier product charts. We can always send that to you if you're looking to work in a state like PA. Just let us know when we get the follow up out to you.
yeah.
Nathan, are the 12-month STM policies available in Michigan? So, Michigan, previously, the regulation was no more than 6 months of short term medical coverage in a given 12-month period. As far as I know, it's still going to be 6 months right now. Again, these are very new changes we're seeing with that not being enforced now by CMS. So just send us some questions for the states that you're working in. I'd
Yeah.
prefer to double check those and make sure I'm giving you guys the exact correct answer. All right, let's keep going down. Is short term medical available in California? No. Michael, had some discussion in that part about, I guess, how this is exactly being enforced, or rather not by CMS. Again, I'm going to get the statement out to everyone. If you choose to sell short term medical, just know that it's more on the carrier being able to offer these plans than you as the agent. Let's see here. Keep going down. ACA in Oregon, we touched on that. Danielle, thank you for clarifying the Patient Protection and Affordable Care Act versus CMS final rule. You are very welcome. Let's see here. Final rule applies to decisions made by CMS on Medicare and MA products as well. I believe that's the case. I'll say,
Thing, yeah. So that's it's a bit confusing because we all deal with the CMS final rule, and that just came out, or the anticipated final rule for Medicare. And so we are all governed by CMS. The rulings come out the same, and so we're trying to report them the best we can, and it does get a little confusing.
yeah, thank you, Kathy. I was going to say, I've been so ingrained in kind of the individual market the past few years. I started doing Medicare at JSA when I started 8 years ago now, which is crazy. But frankly, all my attention has been on the individual market. So
Yeah,
I'm not the greatest person to ask about that. So I'm glad I have you here today.
sure.
Let's see here. I talked about more income verification. I think we hit on that. Let's see here. We put our email in the chat. Again, ACA@jsaonline.com. Any questions you guys have, we all monitor that inbox on the ACA team so we can help you out.
Just to clarify again, Part B will have a penalty if they stay on ACA, if they're eligible and their Part A is free. They will get a penalty for not getting it and probably be kicked off of ACA.
Okay, going down here. Yeah, so the invite for this webinar, we put out everything on a national basis in terms of our marketing blast. So I do apologize if this didn't directly apply to your state-based marketplace. We try to hit, kind of the big topics for the last month with what we want to talk about, make sure that you guys are engaged and aware of what's going on. If you have any questions about working in a specific state-based marketplace, let us know. Happy to research that for you. Darla said my birthday. I think that was in regards to the Illinois
825.
cutoff. Or the
You had to jump
825.
off, but happy early birthday.
Darla, if it's 1017, I'm gonna give you a call
Maybe it was
and say hi.
1017.
Make sure you did your Illinois certification if you're selling there. What a birthday gift. Do a test. We answered Carmen's question. Thanks again, Carmen. Great to see you on the chat. Hope you're doing well. I might see you in a month, actually, if we're going to go hang out with RMA. Let's see here. If a person is applying for 2026, how would they have documentation? I'm assuming that means about income. They can provide a pay stub. The marketplace is going to be kind of loose in what they want for verification. And in general, a marketplace notification will tell you what the client needs to provide.
I'm hearing that some affidavits, I don't know about income, but you can do a self affidavit for some of the verifications.
Yeah,
Some of that.
it's all a little bit new. I mean, we're still getting agent feedback on stuff like that, so
Yeah.
trying to stick with it as much as we can.
Yeah.
Sharon, can I get a phone number to contact you? Yeah, we'll put that in the chat, and it's always in my follow up email as well. We have a great team here at JSA. I know I'm on this side, so I'm biased, but really the people I see working our boots on the ground service every single day and how quickly we answer calls is really phenomenal. I'm very proud of our team.
Just email us. I didn't want to put my number out and have 100 calls at once. So just shoot an email over. You can, you have my direct line. It's my personal line, and text or call or email. We know you guys are agents. We know you have burning questions. We try to do our best to make sure that we're here for you.
Yeah, exactly. I mean, hey, we're busy people, but we're busy because of you guys. So I'll always try to get back to you within a day if I'm able to. Michael, California pays at least $1 APTC, so no one should be subject to the $5 renewal who has no subsidy unless that's changing. Haven't seen anything about that yet, Michael. I don't think California is going to be impacted by that. Short term medical in California yet? Nope. Let's see here. I think I heard this. Subsidies will be available to people making below 400% federal poverty, cut off above. Yes. So that's sort of the return to the form of how the subsidies work classically with the marketplace. Anybody above 400% FPL for their household size is going to be strictly cut off from tax credits going forward. Kind of sucks, but it is what it is. It's nothing new. We've dealt with that in the past. Again, for a household of two people, looking at about 85,000 for a household of one, more around 62 to 63.
Helen
Let's keep
asks, are both Part B and D penalties permanent for late enrollment? Helen, this is pertaining to Medicare, and just because I know I can answer, yeah, they're permanent. It's an additional amount. It's like 10.1 or 10% for either of those two. There's a calculation you do times the number of years or months that you haven't had it, and that's the addition that you'll pay on top of whatever the monthly premium is. You'll pay more than everybody else's monthly premium of the 185 or whatever your Part D cost might be. It's permanent.
Danielle asked a good question. Excuse me. A little bit more clarification on the $5 thing. I know that's been a hot topic for a lot of agents. So basically, the question boils down to if they have the $5, how long will they have to square up on that until the policy terminates? And the
Good
answer
question.
is that it's not going to terminate if they pay the $5. The issue is that some clients may not have up to date banking information if they haven't had to pay a premium in a couple years. But once they provide their income verification to show that they have the subsidy available for a $0 plan, that $5 premium will go away. So essentially, they have indefinitely to prove it. It's just really the importance of being able to pay that $5 when they haven't done so in the past. And Carmen asks, can you send the $5 thing to everyone in the meeting? Yeah, I'll include some additional information on
So
that.
what if I didn't want to prove my income and I'd rather just pay the $5?
Then you're down $60 in a year.
Interesting.
and you can stay on that plan. Maria, I didn't hear if this all applies to Oregon. Yes, Oregon is on the federal marketplace. Where can we find your podcast? We will have that sent to you directly in a link in my email to every one of you fine attendees tomorrow. Any ACA carriers in New York, we offer Anthem, but they are non commissionable. New York is very strict about their ACA policies. For everyone that is saying thank you, I thank you right back. We really appreciate that. Scott, is short term available in Texas? Yes, currently for 3 or 4 months maximum. We will see if that changes very soon. We talked about Helen's question on the ACA creditability and Part A stuff.
Determine what
18-month maximum. So short term medical in Wisconsin, you can currently get a 12-month policy with Allstate, I suppose. They didn't change their regulations along with the federal ones that hit last year. So Wisconsin, you can do 12-month with a 6-month extension for most carriers, 18 months total coverage. Okay, we had some of the Part A and B questions.
I think
Helen,
we answered
Kelly,
all of that.
Melody, thank you so much for attending. Short-term Wisconsin. Yeah, cool. Look at that. We did our
Did
Q&A.
it.
Awesome. Thank you
Did
guys.
it.
Look at that. We had like 30 minutes of Q&A thanks to all you lovely folks.
We love it. Keep the questions coming. There's lots of questions. There's lots of changes, guys. So we want to be in the know and let you know. If there's something burning, please email us, call us, whatever we can do to help.
Absolutely. You know, this is not only a resource to you guys, it's an opportunity for us to learn more, to hear
Sure.
from you guys in the
Yeah.
field, which we find so valuable. I'm in an office every day. I'm working on my computer. I'm not meeting clients or doing enrollments directly myself. I don't sell. I work for JSA. That's what I do. So having that feedback from those that actually do is so crucial to us so that we can continue to educate and share and make sure that we're uplifting everybody who works with us to be more knowledgeable and better for our clients out there, which is why we do this. We do it to get paid, but we also do it to help people. That's a great byproduct of this industry and this job, is that we're able to impart this knowledge onto everyday people because insurance is admittedly way more confusing than it probably needs to be. And that's why we're here to make sure that we make it digestible and understandable, not only for our clients, but for ourselves as well. When things like this happen and a bunch of changes come up in a year, we want to all be there for everybody. And I'll be the first to say that I'm not infallible with all this. This is some really high level stuff. Some of these questions that we're getting. So again, if there's something that I need to double check and research for you, I am more than happy to do so. So please just reach out to us. We are here for you guys. And again, from both Kathy and I think I can speak to say thank you so much for spending this time with us today.
Yeah, we've got some cool things coming up too, since this is going to be recorded and sent out to everybody. Register for August 19th. It's myself presenting for leads. So I'm going to cover how to get leads for ACA. And, this works for a lot of different businesses, but I'm going to just share things that I've done as a broker, currently do, and what I help agents do, and some lead marketing tactics that we can go through. You can catch Alex live in Wisconsin for the next week, I believe, at 4 different events. And Alex will be hosting our ACA 101. So if you're new or if you just need a refresher, I believe it's going to be on the 27th at 4 p.m. Eastern, September 11th. That's the second Thursday of each month at 1 p.m. Eastern. We try to get as much information as we can. You can catch me in Orlando and Tampa at the end of the month. And then I think Alex will be back in Colorado at a zoo event and some just exciting stuff happening. So, guys, keep selling. We appreciate your time with us and keep the questions coming. So, I think that's bye for now.
I think so. And again, thank you all you guys from the bottom of our hearts. We really appreciate the attendance and the participation today. And we just want to say this is going to be an interesting year across the board, Medicare, ACA, all of it. But we're here for you guys. And I hope to see you all in our presentation again in a month. So thank
Yeah,
you
we
so
had a
much.
quick question. Where in Tampa? I have an event at the Tampa Aquarium. You should have got notification for that. Please register. You get a free pass to the aquarium. We'll have some presentations and parking is covered and lunch. So
Done. We'll get
come
that
on and
over to
see
you.
us. Oh, and Top Golf too in Tampa. So yeah, come see us. We'd love to meet you.
All right, awesome. So, with that, everybody, we hope you have a great rest of your day and week. Let us know if you need anything else. Again, all of you will receive a follow up on this tomorrow. And hope you're having a good one. Thank you so much for joining us.
Bye now.
Goodbye, everyone.